Unthinkable. The European Union wants to make Cuba its next investment stop. The European Union plans new business ventures to increase its influence in the Caribbean and tap into a still transparent market. The trade bloc is fleeing Washington's imposed tariffs and seeking other financial horizons. Europeans are returning to Cuba to develop the socio-economic context based on biotechnology and the pharmaceutical market, while planning to invest in new technical and innovative opportunities that, combined with Caribbean knowledge, will boost them in the international market and meet the demands of the old continent. Stay with us until the end, because what you are about to hear could change how you view global power. Next, we'll give you the details you need to understand what's really happening and stay one step ahead. This is News for Dummies, where we explain everything to foster your critical understanding of current events. Cuba shakes Western imperialism after the European Union also landed in Havana to promote the economic transition and innovation of new businesses concerning biotechnology. Europeans want to put their money on the island because they recognize Cubans' cognitive abilities and especially value the importance of medical development. At the same time, they meet pharmaceutical, healthcare, and biotechnology demands in Europe. Cuba is consolidating as a pillar of healthcare autonomy in Latin America and the Caribbean, as demonstrated at the 16th International Health Fair held recently at Pubexpo, where the European Union set the tone for increasing investment on the island. Likewise, at a panel sponsored by Cuba Pharma and the EU, several experts shared how the Cuban biotechnology and cooperation model can transform the regional healthcare landscape. In this context, Ernesto Chico, PhD and biotechnology expert, emphasized that Cuba's industry has established a strong presence in international markets, especially in Latin America, Asia, and the Middle East. Despite the progress, Chico explained, Africa represents an expansion horizon for Cuban products that are still little known on the continent, but have enormous potential. Among the industry's most outstanding products are innovative drugs and vaccines that have proven competitive in the global market. Maida Mori Perez, president of Cuba Pharma, emphasized that the true engine of its industry is human capital experience and the collaborative approach between institutions. She explained to Europeans that, unlike other countries where competition between research centers prevails, Cuban institutions work together, making it easier to respond effectively to pandemics. Technology transfer is a natural part of the Cuban model, which has shared its knowledge in several countries, including South Africa and Mexico, strengthening local capacities. Undoubtedly, the EU is interested in a market that can drive several international projects and meet the healthcare needs of its region. Mori confirmed this openness is no accident but responds to a spirit of solidarity and firm government support to expand access to medicine and healthcare technology. Another topic of interest to Europeans regarding positioning in Havana was the need to strengthen ties between regulatory authorities and the industry to streamline processes and consolidate technological sovereignty in the region. Mori warned that Latin America needs a structured cooperation strategy to avoid exclusive dependence on major powers during critical moments. With its experience and willingness to share technology, Cuba could be key to this regional health and development architecture. However, to sustain this momentum, Cuba Pharma needs investment and recapitalization, a process in which collaboration with international partners is fundamental. That is why the EU presents itself as a privileged partner, providing cutting-edge technology and financing projects that expand Cuba Pharma's capabilities. The arrival is no coincidence, especially now that BRICS has welcomed the Caribbean island as an adhered partner, offering facilities and foreign investment opportunities while exploring new markets. Based on these characteristics, the trade bloc flees tariffs imposed by Donald Trump and bets on the historical enemy of the United States. It sees Havana as the necessary investment capital in biotechnology to increase the development of its plans. Consequently, Europe perceives public health as a strategic space to join forces and is driving the global gateway model, which seeks to mobilize large resources through concentrated investments. For this reason, Vicente Vez Bancomo, director of the Finley Vaccine Institute, highlighted the immense challenge faced by Latin America, where only a small part of the vaccines consumed is produced. The region's common vaccine fund is dominated by large pharmaceutical companies, driving up prices and limiting access for the most vulnerable. In fact, the EU-Cuba alliance could minimize costs and investments to expand the market to different regions of the planet. To compete in this scenario, Cuba must significantly increase its vaccine production capacity, ensuring competitive prices and high quality. Judith Roos San Juan from the Pan American Health Organization acknowledged Cuba's public health ecosystem as an example for the continent. For Piejo, the Cuban model, based on health as a right, offers a roadmap to build sustainable healthcare systems in Latin America. In this sense, collaboration between Cuba, Europe, and Latin America could be key to creating robust technological infrastructure focused on equity and sustainability. One of the most promising developments presented at the fair was Neuroepo, a drug from the Center for Molecular Immunology for treating neurodegenerative diseases. Set Leon Monson recalled the project was born from research on recombinant erythropoietin and its potential beyond anemia treatment. Neuroepo is administered through nasal drops, has a high safety profile, and has slowed the progression of Alzheimer's, something never before documented. The drug is currently undergoing clinical trials in Cuba, and is projected toward international markets with collaborations in countries like Canada, Russia, and Brazil. On the other hand, Yanier Núñez Figueiredo presented another innovation, JM20, a hybrid molecule designed to act on multiple fronts in diseases like Alzheimer's and Parkinson's. Europe was undoubtedly stunned by Cuba's innovations. JM20 has already shown remarkable efficacy in preclinical studies and has patent protection in several countries, reinforcing its strategic value. Europeans want this type of drug in the old continent. In addition, the Center for Genetic Engineering and Biotechnology highlighted its star product, EverPR, a treatment for diabetic foot ulcers that has prevented thousands of amputations on several continents and began its international journey in 2007. It is now preparing for clinical trials in the United States, opening doors to a crucial market. Europe wants to go all in on Havana, focusing on biotechnology and betting all its investments on the Caribbean island. Meanwhile, Cuba, with its science and solidarity, is positioning itself not only as a drug exporter but as a model of international collaboration for public health. Cuba's emergence as a biotechnology powerhouse is reshaping the global health landscape. With the European Union eyeing major investments on the island, a historic shift is underway, blending Caribbean innovation with European resources. From cutting-edge Alzheimer's treatments like Neuroepo and JM20, to revolutionary diabetic foot ulcer therapies, Cuba is demonstrating that it's not just a player, but a leader in global health. This partnership could dramatically lower costs, improve access to vaccines and medicines, and reduce the region's dependence on major pharmaceutical giants. As the EU seeks to sidestep US tariffs and diversify its investments, Cuba offers a rare opportunity, a resilient, innovative, and collaborative healthcare system ready to scale on the world stage. This moment marks more than a business deal, it's a geopolitical statement. By investing in Cuba, Europe signals its intent to challenge US dominance in the region and build a more equitable global health infrastructure. As Latin America, Europe, and even Africa look to Havana for solutions, we may be witnessing the rise of a new medical and economic axis that could reshape power balances across continents. Now it's your turn. If you found this analysis revealing, leave us a comment with your opinion on this shift. Can Cuba and the EU truly reshape global healthcare? Subscribe if you haven't already, because we'll follow this partnership's evolution closely. Hit the bell icon so you don't miss the next video, where we'll explore how other global powers might react, and what's next for Cuba's biotech revolution. And if you want to dive deeper into Cuba's medical breakthroughs, click now on the video on screen. I promise, it will surprise you.